Hey guys, we wanted to review some of the structures of the nasopharynx. Brendan talked a lot about them with the gross specimen in another video, but we thought it might be helpful to go through them again with a model just because you can see things a little bit more clearly in the model than you can in the gross specimen. So to do that, we are going to use what I like to call the book nose. So if you picture a nose like this, we've hemisected it and opened it this way. So you can see both lateral aspects of the nasal cavity opened up. So just to orient, let's review some of the structures that we've talked about in other labs. So here we have the sphenoid sinus with the sella turcica, and remember that's part of the sphenoid bone. So we have the hypophyseal fossa with the dorsum sellae and the anterior clinoid process with the optic nerve running in the optic canal. As we move anteriorly, we can see crista galli, which is the protuberance superiorly from the ethmoid bone, and then the frontal sinus, which we can see on both sides. If we move to the other side, we can see crista galli again, and this time we see cranial nerve 1, the olfactory nerve, running along its course before the fillet descend into the nasal cavity. Now let's talk about the nasopharynx itself. Brendan mentioned this in another video, but here we see the superior nasal concha, middle nasal concha, and inferior nasal concha. Both the superior and middle nasal concha are parts of the ethmoid bone, while the inferior nasal concha is a bone in and of itself. Even further down, we can see portions of the hard palate, which is comprised of the maxilla on either side you can see, and then the horizontal plate of the palatine bone, which I'm pointing out here on the right. Moving along, as we continue on the side of the model that has the mucosa, we can see the pharyngeal tonsil at the posterior aspect of the nasopharynx, along with torus tubarius, which Brendan talked about in a different lab, and then the soft palate, which we see here, which is contained the muscular uvula. And even further down, even more inferiorly, we see the palatine tonsil with the palatoglossal fold running anteriorly and the palatopharyngeal fold running posteriorly. At the anterior aspect of the oral cavity, we see this muscle cut in cross-section, which is going to be orbicularis oris. Now, if we go back, we can talk a little bit more about the different nasal concha and where the different sinuses drain. So here we have the sphene-ethmoidal recess, which is going to drain the sphenoid sinus that I pointed out earlier. The superior nasal concha has a space beneath it where the posterior ethmoidal air cells are going to drain. The middle nasal concha is going to be the location of drainage for the frontal sinus, the anterior ethmoidal air cells, and the middle ethmoidal air cells. And if we remove this, we can see what Brendan pointed out in another video, the ethmoid bulla, as well as the semilunar hiatus. Now, if we enter the semilunar hiatus, where my probe is now, that's going to lead into the model's left maxillary sinus. So all of those structures are going to drain inferior to the middle nasal concha. Last but not least, we have the inferior nasal concha, which is the location of drainage for the nasolacrimal duct, which begins at the medial corner of the eye and descends.